Okay, in this video, we're going to talk about pulmonary and systemic circulation. All right, so what you see pictured here is the heart and your major vessels leading out to the lungs, the body, and towards the head. The pulmonary circuit is short, low pressure circulation, moving from blood between the heart and the lungs only, hence the word pulmonary. So these systemic capillaries on the top of your screen here show now blood entering from the above the heart will be the superior vena cava, and then you will have blood coming from the lower body or below the heart will enter in through the inferior vena cava. And as you can tell using the arrows here, they are traveling into the right atrium. Now, this blood in the pulmonary circuit is transporting deoxygenated blood between the lungs to absorb oxygen and release the carbon dioxide. Now, the blood is going to be pumped and heading towards the lungs. Sometimes this is known as the pulmonary circuit or loop. Exits the right ventricle of the heart and passes through the pulmonary trunk. Pulmonary trunk will split into right and left pulmonary arteries, and these arteries will transport the deoxygenated blood to the capillary beds in the lungs. There's carbon dioxide will be released, and we will absorb oxygen. The oxygenated blood then passes from the capillary beds back into the pulmonary veins. The pulmonary veins will transport it to the left atrium right here and on down into the left ventricle and all the way back up through the aorta and back up towards the head and the arms or down to the rest of the body. Now, a good thing to remember here is that the pulmonary arteries are the only arteries that carry deoxygenated blood. And the pulmonary veins are the only veins that carry oxygenated blood. Okay? Now, just remember that this circuit, the pulmonary circuit, only transports blood between the heart and the lungs. Now, the systemic is a longer system, and it circulates between the heart and the entire body. The systemic circuit or loop, the oxygenated blood will be pumped out of that left ventricle of the heart, which is the largest artery in the body. The blood moves from the aorta through the systemic arteries, then to the arterioles, to the capillary beds, and that supplies the body's tissue. Here, oxygen nutrients are released, and carbon dioxide and other waste substances are absorbed. Deoxygenated blood then moves from the capillary beds to the venules into the systemic veins. The systemic veins feed into the inferior and superior vena cava, which are the largest veins in the body. And that deoxygenated blood will flow into the right atrium, and the circuit will repeat itself. So remember that the systemic circuit uses the heart and the body. Okay? Both of these systems work together in tangent and involve the respiratory system.